Hello, and welcome to Marketplace with Charles, brought to you by Art of Skincare. Art of Skincare, the company that brings out the beauty in you. Also our new sponsor, Kuisa Lodge, situated at the heart of Mabalingwe Nature Reserve in the Bela area. I am Charles Ngobeni. On Marketplace, we aim to empower, encourage, and equip you with the right tools that you need to move closer to you achieving your entrepreneurial dreams. Each week will bring you insights from experts in different fields of business, from men and women of faith, but also from ordinary people from all walks of life. Today we meet a well-rounded medical practitioner. She worked her way up from being a general practitioner to a specialist in the subfield of gynecology. As if that was not enough, she continued to super specialize in her field. She's a specialist, a wife, a mother, a minister in the kingdom, and currently studying further. There are several bases of businesses. Some are based on people's hobbies, others on talents, others on opportunities that arise, whilst others are propelled by and founded on education. In an era of tenders in South Africa, many people find themselves sidelined by the elusive tenderpreneurship, which I'll call it a bubble, to the point that they no longer see the value of professions that they spend so many years studying and preparing themselves, going through schools, going through formal education. In this way, people miss opportunities that will otherwise make a big difference in their lives, make them big monies, and change lives around them. Some of you are watching us complaining that there are no jobs. No one wants to employ you. Yet you have got that hard-earned qualification. My guest today will help us revisit and revive in some of us the taste for these profession-based opportunities that are being left unexploited. You know, I remember very well the other time, I had a debate with my late father. I said to my father, Dad, look at your pictures that are hanging on the wall. So many degrees, so many qualifications. Some other people have got degrees, agricultural degrees, BSc in agriculture, but they can't even plant a tomato with that degree. So sad. I said to my dad, every person who's highly qualified, if they fail to turn their degree into something tangible, they will have failed. I remember very well because I was studying electronics as well. I said to him one day, instead of seeing Hisense, instead of seeing Sansui, instead of seeing Pioneer, instead of seeing Blaumpact, I want one day to have a TV by the name of Charles. He laughed. And today, guess what? I've got my own skincare company. I've got my own roll-on, which I've named under myself, Charles Roll-On. So ladies out there, mawufuna makhwapeni, faka uCharles. Well, Dr. Q, Dr. Qinisile Diale, allow me to call you Dr. Q.
Yes, sir.
Welcome to Marketplace with Charles.
Thank you so much for having me, and greetings to all our viewers.
You know, Dr. Q, you look so young.
Thank you, sir. I take it as a compliment.
And you're a specialist, and you're studying further.
Yes, sir.
You have achieved so much. Do you want to tell our viewers just a little bit who Dr. Q is?
Okay, so I'm Dr. Qinisile Diale, a.k.a. Commonly known as Dr. Q, as you've mentioned.
Yes.
I am working currently as a specialist in the field of obstetrics and gynecology. I'm working under Unitas Netcare Hospital and based in Centurion. So that's the field I specialize in.
So you started as a general
I started as a general practitioner, and that was also to afford me time to start with, because we want to balance in life and we want to achieve more things than one. So I was a young mom by then, and it was just to get the family started for a few years, and then one decided to forge on in the career.
Somebody once said to me, general practitioners are the people who practice on you.
Who practice on me? Fortunately.
No, the doctors have got practices.
Yes.
You go there sick and then they practice on you until you die.
It shouldn't be that way. And that's why we have a specialist. So
that's why you turned into a specialist.
That's why I turned into a
from
specialist.
Practicing.
No.
You practice until you become a specialist.
Fortunately, okay. Our government makes sure that you spend a whole lot of, a number of years, it's actually 3 years. 2 years as a community service, 2 years as an internship, and 1 as a community service doctor practicing under supervision. And then you can continue working as a GP. But then it has to do also with what one aspires for in life, if you remain as a GP or you continue to specialize. For me, it actually took some introspection, looking at myself, looking at my passions, what excites me, what is it that I want, or where is it that I want to see myself in life. And also then you look at the marketplace. Where is there a gap in the market? And then how can you find your niche? Where is there saturation in the market? And then you then decide on the field, following your passion and letting the market guide you as well. And then that's how I personally ended up in obstetrics and gynecology, amongst the multiple fields in medicine that they are.
But what else prompted you to push the frontiers and refuse to limit yourself?
It's also understanding personally the quality of life that one actually wanted to have. As I said, I was a young mom. Then there's, in my field, hours that you spend in the hospital, where you sleep at the hospital or spend the night at the hospital assisting patients. You're not allowed to be at home. And also looking at, as I said, the marketplace, there's multiple or numerous young graduates that are coming into the field, that are graduating into the field. And you wouldn't also, I personally didn't want to find myself being at the entry level of my career. So that's why I decided then that let me invest in myself, let me upgrade myself, as Jay-Z would say. So yes, then that's when I decided to take the challenge. It's not easy. Again, as you said, it's numerous years of studying full-time and working and doing other things in life. So specializing into gynecology had to call for another 4 years on the desk, an extra 4 years on the desk, and you're working hard. So that's the challenge.
I like the way you put it, investing in yourself.
Yes.
And upgrading yourself.
Exactly.
Would you say any other person out there can do what you have done? Or was this meant specially for you? You were born by and created by God for this, or any other person can achieve that?
Absolutely, everybody else can, and in all different kinds of field, it is possible. As we know, we go into the educational field. You get your first qualification. And then it actually depends on what is it that you want to do with what you have in your hand. So be it in the field of law, be it in the field of business or accountancy, every person has got the opportunity and the chance. And as long as they have the will, they can take on the challenge to actually go on and do some self-investment and forge forth.
Let's talk about gynecology. Is it related to cervic cancer?
Yes, much so. And
Can you take us through this deadly disease? Because I'm just getting out of
our
program here a little bit.
Yes.
But I know there are a lot of women who are dying because of this silent disease, silent killer disease.
Yes.
What is it?
Yes.
And how can our people get help?
Exactly. I'm glad that you actually put it as a silent disease, because it's if we look at cervical cancer, it's the second biggest female cancer killer in the world, and it seconds breast cancer. And in most of the talks that I would do, I would make an example of people being aware of a pimple that is growing on the face because they can see it.
Yes.
But they don't walk around looking at their own cervixes. So the cervix is the mouth of the womb, and the womb is an internal organ that women have, which is mainly for childbearing purposes. So what happens is, during sexual intercourse, there is this common virus called human papilloma virus that actually has got an affinity to the cells of the cervix, which is the mouth of the womb. So this now can either clear before the age of 30, it goes away. I usually call it a sexual flu. So it can clear away on its own. But unfortunately, there are some women, and they wouldn't know whom they are, but there are some women where the infection does not clear itself. So mostly at the age of 30, if you do what we call a pap smear, and you happen to also check for the virus HPV, you would know whether you are infected or not, and you would know whether the infection has caused abnormal cells or not. And if you miss such opportunities of testing before the disease progresses, then it grows internally until by the time you see symptoms, it's already a developed a disease. So then women will present with vaginal bleeding, bleeding after intercourse, and pelvic pains, or an offensive vaginal discharge, and all those other symptoms. Already those are saying there's a disease process going on.
Is breast cancer related to your scope of work or not?
Not completely so, because most women prefer to be examined by or to be assessed by gynecologists. Then we find ourselves actually including a breast examination as well. But when it comes to things like operations that are needed for breast cancer, we do not, as gynecologists, operate on the breast. So we can assess, we can assist with mammograms, we can assess with the routine examinations and diagnosis. But when it comes to the actual treatment, the chemotherapy and the surgical intervention, that is handed over to the surgeons. So we usually say the surgeons and the gynecologists share the breast.
We share the breast.
We share the breast. Yes.
I like that. I'm not a woman, as you can see.
Yes, definitely. But you have women in your life.
Yes.
Who are very dear to you. Well, it can be your mother.
I love that. Now we are clarifying.
Yes, yes, yes. Or your wife and sisters and cousins, and they are beloved
no, and kids.
to you. And kids as well.
And grandkids now.
Oh, grandkids by now. You look too young for that. Hey.
Yeah,
then you're well kept by your skincare products, I take it.
No, definitely. Definitely so.
They're doing a good job. I must get myself some.
No, great.
Thank you.
A lot of women,
yes,
when they come back from, you call it a mammogram?
A mammogram.
Mammogram?
Yes.
They complain because they take that small little breast which your kids has already sucked for so many years. I understand they put it into something, they squeeze it. Is that so? Is it painful? And how can you encourage people to go through that pain for the sake of their life?
Yes, yes. That's the report that we get from most patients, that it's painful. But, pain is a relative statement.
Yes.
And it's very subjective. Not taking away the fact that it could be painful. I spoke to just a lovely patient of mine just recently who said, my mom told me that the mammogram is the most painful. She has 7 kids, but she said the mammogram is the most painful experience she's ever been through. And I said to her, okay, so how's the pain of cancer? Would you
Oh.
then rather tolerate the pain of cancer than a pain of a small procedure that you do same time and you're out? So, but it would be nice if new technologies would be developed that will be able to assess the breast. It's not as if the breast is squashed, as if maybe sucking a cow or something like that, but it's just placed between two beams. Where it can be able to be assessed throughout the anatomy of the breast. So even pap smears, women say they are painful. I call it a discomfort. And it's just 2 minutes and we're done. And then you know you've saved yourself the more serious pain, which is very traumatic actually for women going through cancerous diseases.
How often should one do this?
Okay, when it comes to breast cancer, the recommendation is that you have a mammogram from the age of 40 onwards.
From the age of 40?
Yes, from the age of 40, women are recommended to please go for mammograms. This can be on a yearly basis or at least once every 2 years. So no 2 years must go past for a woman who's above the age of 40 without really checking on the breast, especially women that have got a family history of a first-degree relative, which would be a mother or a sister who has had breast cancer disease. And then when it comes to a pap smear, the recommendation is that you have a pap smear. If you have tested for the virus itself, which is the HPV virus, then you can actually place your pap smears or space your pap smears to be between a range of 3 to 5 years. You can have them every 5 yearly if your HPV DNA test was negative. And then if you've just done the pap smear itself, at least every 3 years. With the understanding that unfortunately in the government sector, these cannot be afforded for by the government to have a woman doing pap smears every 5 years. So our recommendations, which we are hoping will be re-evaluated soon, are currently standing at having a pap smear at the age of 30, 40, and 50. So every 10 years, according to the affordability of the government. But if women can afford to test more frequently, at least every 5 years, then they're more than welcome.
Oh, great.
Awesome.
As a gynecologist, you have got your own, should I call it private practice?
Yes.
Although you're not practicing on people?
Yes, sir.
But that's what it's called.
I'm practicing the skill of medicine.
You're practicing the skill of medicine.
Yes.
You know, the other time I went to visit another doctor, and I had an appointment. I went there. I waited and waited and waited. After 2 hours, then he said, I said, but doctor, I had an appointment. But you still delayed. If appointment is 8 o'clock,
Okay.
you must see me at 8 o'clock. He smiled back at me and said, only doctors have got a waiting room.
And they see patients. We should practice patience.
Yeah, we need to practice. But anyway, tell me, where is your practice? Where is it located?
My practice is based in Centurion, in Pretoria, Centurion. It's found at Unitas Hospital in the building just next to the main hospital called Lifestyle Center. And it's in Clifton Avenue, and it's office number 205, second floor.
And you are still studying further?
I'm studying further, yes. I'm progressing my
that.
career. So yes, I'm currently doing what others will call a second master's degree. It's with the University of Pretoria. It's under the category Masters in Philosophy. They call it MPhil with the University of Pretoria. And with the colleges of medicine, it's a certificate in reproductive medicine and endocrinology. So,
reproductive
medicine.
And what is it?
So reproductive medicine, we are basically dealing with women. It's an umbrella of addressing women at their different stages of their reproductive life. So we see conditions from women who are adolescents, delayed puberty, and all that. And then we address women who are in their reproductive ages, where we address women who are dealing with endocrine diseases like polycystic ovaries. Then we assist women who are struggling to fall pregnant. We address them as a couple. So families that are struggling to fall pregnant, we assess the couple, see where the obstacle could be, where the difficulties could be, and after the assessment, making a diagnosis, then we have intervention methods which vary as well, ranging to the level of in vitro fertilization, where we take out the eggs from the lady and the gametes from the man, do the fertilization in the laboratory, and then we implant or transfer the embryo back into the female. Then that will be then, and then we even address issues of menopause and under endocrine diseases as well.
You call it menopause. Is it a pause or is it a menostop?
We'll call it a pause because she's still alive.
Okay. But tell me, Dr. Q,
of life.
What is your experience with studying? While you are a specialist, you are a wife, you are a mother, but most importantly, you are a minister at the same time.
Yes. Oh, it can be quite challenging. It's a taxing position to actually find yourself in, and you know, people can even find themselves at the point of burnout. But one needs to be aware of a few things. In a phase in my life where I really found myself overwhelmed and you feel like you're not doing enough. You feel like, am I just existing in my studies? Am I just existing at home? Am I spending enough time with the kids, with my husband, with the rest of my family and my studies and my work, the private practice and government sector? So I ended up just coming up with 5 Fs to help me balance my life, if there's such. So I sat and I think better with the paper because a lot of things were cluttered and a lot of priorities when you just have so much to do. So I sat and I just had to prioritize. And the 5 Fs, if I can share with our viewers and yourself, firstly begin with F number 1 being faith. Yes. Because I find faith being the foundation of all things. And so I had to, I recommend even to people to feed their faith. And you cannot give what you do not have. Yes. So feed your faith, spend time, even if it means 5 minutes just after waking up, before you even start your day, be it reading a scripture, be it reading a motivational quote, feed yourself from within, from internally. So that's faith. Then the second F that I found to be very vital in everybody's life as well is your fitness, your physical fitness. This will be now your health. Are you taking care of your health? Are you making sure that you are drinking water? Because now if you look at all these priorities that we have, you need this actual body to take you to work, to take you to your child's school, to take you to, but are you taking care of this body itself? So that was under fitness. So it's exercise and watching what you eat. Then, having taken care of your faith and your body, then it's family, the next priority. Then, when you've taken care of yourself, you can take care of others, be it family and friends, and having fun as well. Then also comes my future, which will be then climbing the corporate ladder, my career, and focusing on all these things that also need me. And then last but not least is finances. Money makes the world go round. And most conflicts, even in marriages and everywhere in the world, you find that most things come from money. So if you do not manage your finances well, it could also be a source of large amounts of stress as well. So those are my 5 Fs that I find to actually assist myself in trying to balance all these multiple roles that one is facing. So whenever one is off balance, I go back and I check, where am I missing? Is it my faith? Is it my fitness? Oh, I haven't exercised for long. I've got fatigue, chronic fatigue and all those things. And then that's how I try to balance.
Now I've got a different view of the letter F.
Yay.
You have just changed my life.
Amen to
I
that.
hated the F.
Oh, the F word.
Not only the F word.
Okay,
It
the
also
letter
stands for,
F.
you know, at high school when you're studying,
Yes.
whenever you see the red F,
Oh, yes.
that spells disaster.
So these ones are keeping you away from that
Yes.
F.
When you started about you wanted to talk about the 5 Fs.
Yes.
In my heart, I was saying, oh my God,
Not the F.
she's messing up with my program. The 5 Fs. But
Yes.
those are the greatest 5 Fs I've ever had. And
Thank
I'm going to
you.
live by.
Thank you.
Briefly, you are the minister of the gospel. What do you
Yes.
do as a minister?
Well, I actually have a passion in giving back. I have, I'm very fond of my community. And I currently am working in giving back to young women. And not just young women, also women of all older ages as well. So I go around doing talks, health education for women, using my profession, using my knowledge and background. So the questions that you've been asking, I call it free consultations.
Yes.
You know, it costs nothing less than 1,000 rand to get a first appointment with a gynecologist. So if a gynecologist can come to you and tell you all the things that you need to watch out for and to take care of yourself. So that's what I do. So I do health talks, and then I actually have a movement for young girls, which I'm very passionate about. It's called God's Good Girl, I Am Gold. So we give back to young girls from education, highlighting things about the 5 Fs, you know, things that, you know, they don't need to wait until their life is a mess and they're older before they start getting their lives in line. So we do women empowerment. We focus on their education, tell them about economic independence. They don't need to be looking for blessers. They can be blessing others themselves.
Yes.
Yes, so that is what we actually do outside the career, but using the career to feel to cover it.
And if someone needs to get hold of Dr. Q
Yes.
for all that, for assistance,
Yes.
how do they do that?
Okay, we've got a website. It's drq.co.za. Dr. Q being DOCTOR, Q.co.za. They can get more information on the website, and our address and telephone numbers are there. But as I said, we are, I'm based at Unitas Hospital in Centurion. Our office line is 012-644-0299. And email address is info@drq.co.za. Full word, Dr. Q.
And I am Charles Ngobeni, signing off on Marketplace. My website is charlesngobeni.com. On Instagram, Charles_Ngobeni. Or you can go into my Facebook fan page and like me there, Charles Ngobeni. Alternatively, if you want, you can tweet me. My Twitter handle is @artofskincare. Well, that's all the time we had for today. See you next time, same channel. God bless you.
Join Marketplace with Charles, 11-day tour of the Holy Land. Take the route Israel traveled from Egypt to the Promised Land. Cross over the Red Sea and float on the Dead Sea, the lowest point on earth with healing properties. Experience the vibe of Jericho and cruise on the Sea of Galilee to Capernaum, the hometown of Jesus. Visit the pools of Bethesda, Nazareth, Bethlehem, and many more. Walk where Jesus walked and see the Bible come alive. Return via the Egyptian pyramids of Giza and explore the rich history of the mother of civilization. If beautiful memories and an enriched spirit is what you're looking for, then join us in taking Jesus to the marketplace through Israel and Egypt. For more information, call +27 11 804 7550 or email israel@artofskincare.co.za.